This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, everyone. This is Heiko Lade from the Acupuncture Clinic, and we're talking to you on Radio Hawke's Bay about acupuncture and registration. Now, this is quite interesting because we've got a special guest on the show today. It's Paddy McBride, who is chair of the Chinese Medicine Council of New Zealand. So, good morning, Paddy. How are you?
Good morning, Heiko. I'm very well, thank you. Thanks for inviting me to join you today.
No, and I've heard that the weather down in Nelson's is as good as what it is here. So, but first, Paddy, just tell us a little bit about yourself and how you ended up as the chair of the newly formed Chinese Medicine Council.
Okay, well, like yourself, Heiko, I studied in Australia, but I'm already a Kiwi. I was born here in Nelson. I returned home to New Zealand in the early 2000s, so I've been in practice now for more than 30 years. And I live in Richmond, just south of Nelson. I was president of Acupuncture New Zealand and vice president of the World Federation of Acupuncture Societies for quite a few years. So I've got a pretty good understanding of the profession, both here in New Zealand and internationally. I quite enjoyed the balance of clinical practice along with the more political side of things. So when the Ministry of Health called for applications for the new council, I figured I may as well put my name forward.
And then here you are.
And here I am, indeed. Yes.
Now, first, just tell us a little bit about we've got this an initiative, the HPCA. Well, first, you can actually tell us what that is and how that relates to the new Chinese Medicine Council.
Okay, so the HPCA Act is the Health Practitioners Competence Assurance Act, and it's all about protection of the public. And this act is the one that covers all the health professions, such as the medical doctors, the nurses, the midwives, dentists, physiotherapists, just about anyone medical that you can think of. Osteopaths and chiropractors are also included. And each of these groups has its own responsible authority, or RA. And the role of each RA is to set the scopes and standards of practice for the profession and to register the practitioners. So we ensure that all of those that are registered meet the standards that we've set, and that they work within their scope of practice.
Okay, yeah, and then as you were mentioning before, that you came in the early 2000s, and I was here then as well, and then I can remember the profession was saying, we're going to get registered very soon. And
yes, we thought it was going to be really fast.
Yeah, and so anyway, here we are, sort of almost 25 years later, and we now actually are registered, and we have a council. Now tell us a little about what makes up the council, and how many people are there? Who are they? Are they all acupuncturists?
Okay, so the Minister of Health appoints the council, and the number of people on the council, whichever council it is, or board, some of them are called boards, depending on the number of people, practitioners that they've got registered. And then we also have all of our support staff in our office in Wellington. So on our council, there are 9 of us. We have 5 practitioners and 4 from outside the profession. We call them lay people. Mm-hmm. And we've been blessed with a very competent, experienced council, and the depth of knowledge is quite exceptional. Okay. One of our lay members was formerly the registrar of another RA, so she has a really good understanding of everything that needs to be done. We've got 2 from the legal profession, and the other lay person comes from a family of Chinese medicine practitioners. So although she's not a practitioner herself, she has a really good understanding of our profession.
Oh, great.
And our practitioner members, we've got 1 tangata whenua, 1 is a researcher as well as a clinician, 1's a medical doctor, 1 has a business background, myself from the political side of things. So we cover a lot of bases.
Fantastic.
And all of us that are practitioners, we're all in clinical practice.
So in a nutshell, now that acupuncturists, we have what I think is like a recognised status. They're sort of the same, for want of a better word, as physiotherapists or chiropractors, and then these RAs, as we call them, they protect and inform the patient. as well as governing standards for acupuncturists themselves. Is that the go?
Yep, that's pretty much it. Registration of the profession is primarily about protection of the public. So anyone that chooses to see a Chinese medicine practitioner, they make sure that they're listed on the Chinese Medicine Council register, which is on our website, and that they have a current APC. They can be sure that the practitioner is registered, then they've met the standards that we've set, and that they're also committed to ongoing professional development. And those that have only done a weekend course of acupuncture or taught themselves from online videos or whatever wouldn't meet the standards that we require to have them registered.
So let's just first elaborate a bit about what Chinese medicine, when you say that it helps for the patient and the public, what exactly, could you elaborate on that and tell us how that can help?
Well, you know that if someone's registered with the Chinese Medicine Council, that they've been through a really thorough vetting process. So all of the practitioners that want to register have to provide certified ID, they have to provide certified evidence of their education, they have to also provide a criminal record check, not only from here in New Zealand, but also from any other country that they may have lived in the past, for more than 12 months in the past 7 years. And they have to commit to ongoing professional education, which includes ethics as well as cultural competency and safety, on top of the clinical side of things.
Okay.
So,
and as you said, it will actually, prevent people who have had no training, or as you said, learnt acupuncture on a video or something that's going to stop people from this, actually practicing or trying to practice.
We have what's called protection of title. So only those that are registered with the Chinese Medicine Council can now call themselves a Chinese medicine practitioner or an acupuncturist or a Chinese herbal medicine practitioner or a Chinese massage practitioner or a Tuina practitioner or a Chinese medicine specialist, because it's not just acupuncture. Chinese medicine now, being a registered profession, we have 3 different scopes. We have acupuncture, we have herbal medicine, and we have Tuina, which is a very specialised form of Chinese massage.
Okay. Now, at the moment, do you have any idea how many acupuncturists are currently in New Zealand that will become registered? I presume that there's some people who are not going to get registered for whatever reasons, and what could happen to these people? And another question I have is I can't call myself a chiropractor or a physiotherapist, but and as you said, we have protection of title. So is this going to stop people just putting up a sign and calling themselves an acupuncturist?
Yes, in a nutshell.
Yeah.
We anticipate that there are in excess of 1,000 Chinese medicine practitioners in New Zealand, and we are progressively getting every single one of those to register with the council. We're still in the early stages. We're essentially still in the setup stage and allowing practitioners to come on board. I'll read to you from our document which tells us about who can and can't practice. Now let's have a look. It says, no one may use names, words, titles, initials, abbreviations or descriptions stating or implying that they are a Chinese medicine practitioner, an acupuncturist, a Chinese herbal medicine practitioner, Chinese massage, Tuina practitioner or a Chinese medicine specialist unless they are registered with the council and are qualified to be registered as a health practitioner of that kind. To do so would be a breach of the HPCA Act, and they could face prosecution by the Ministry of Health. So yes, it really is protection of title.
Okay, no, that's really
call themselves all of those things.
Yeah, that's really good to hear. But now, what about some of these other registered health professions, such as physiotherapists and chiropractors, and who I say, and I use the word needling. They may not have had official acupuncture training, and I know some of them have. But the majority of them have done, what we call a short dry needling course. What's going to happen here? I mean, I presume that they can't call it acupuncture, but they'll continue to be able to do the dry needling?
Yes, that's pretty much it. Other professions, such as the physiotherapists, they can still use acupuncture as one of their tools within their practice if they're permitted within their scopes of practice, but they remain registered physiotherapists or registered chiropractors. They're not registered Chinese medicine acupuncturists unless they join our RA.
Right, okay.
And they cannot call themselves an acupuncturist anymore.
Right.
Only those that are registered with the Chinese Medicine Council can do that.
Okay. Now, that was for other registered professions, but what about, I know there's a lot of massage therapists who are not registered health professionals, and many of them do dry needling. Are there any changes ahead for them?
I would suggest yes. As I said, we're still in the early stages of trying to get everyone registered that is
qualified to be registered. Yeah.
Yes. So our focus hasn't gone much beyond that as yet. But those that have a qualification in Tuina or massage may be able to become registered as massage or Tuina practitioners. But that still wouldn't enable them to be able to call themselves an acupuncturist.
Right.
They could call themselves a Chinese massage practitioner or a Tuina practitioner, but they couldn't call themselves an acupuncturist.
Right.
And part of the act is all about if your advertising is such that people would believe that you are something that you're not, then you could be called up on it. Okay.
Now, what about then, the future of acupuncture and acupuncture education? Is that going to be sort of steered along by the council, or is it still just sort of up to the colleges to decide what type of degrees or what type of, how many hours they're going to do for a degree?
Okay, so as I said, our focus so far has primarily been on registration and getting everyone's documentation in place. But we have already started to work in liaising with the schools and with NZQA so that we all know that we're all heading in the same direction. And it is the role of the council to set education standards, and we also accredit teaching institutions. So it's really important that right here at the beginning we establish and maintain good working relationships that will help us all facilitate that. So yes, we will be working with, we already are, but only touching the surface so far.
Now, what about changes to the acupuncture practitioners themselves once we are registered? Obviously, I think there'll be some new things in store for us, but I understand that we'll still be a member of like an acupuncture association like ours, like Acupuncture New Zealand, for things like news, seminars, marketing, promotion. Now, what about sort of the acupuncture relationship with ACC? Will that go through the Chinese Medicine Council or still sort of through the acupuncturists' associations?
It's a little bit tricky at the moment with ACC. With regard to ACC, they already recognise practitioners that are registered under the HPCA Act, so that now includes us as well. But it's a bit more complicated than that because in the past they have specifically included in legislation that they recognise members of the two main acupuncture groups, Acupuncture New Zealand and NZASA. And these groups, they've been written into legislation, so that means legislation, you can't just sort of cross them out. It has to go through all the rather lengthy processes before that can be changed. So until that can be changed, practitioners do have to have an annual practicing certificate with their professional body as well as with the Chinese Medicine Council.
Okay.
We're working with ACC and MB, who are also involved, to get that sorted out. But often these sorts of things take a whole lot longer than anyone would think.
Now, and speaking of taking longer, I mean, what about the future for us? Where personally can you see, a registered acupuncture profession going? Have you got any visions or any ideas for us?
Well, currently most of our practitioners are in private practice, but many of our practitioners actually trained overseas. Predominantly in China, but also Korea, Japan, the States, Europe, lots of us in Australia. There are many hospitals in China and Korea and Japan especially, increasingly in the States as well, and in some particular areas of medicine where Chinese medicine practitioners are employed within the hospital system. So certainly there is in the past, with us not being a registered profession, it's really difficult because whose insurance is going to cover us? But because we're now a registered practitioner, that is essentially moved out of the way. It will take a long time to change the culture, but we can more likely end up in that direction. When I was in Korea a few years back, I was with a number of international colleagues, and we decided that we liked the term collaborative medicine. So we're not alternative to or complementary to other health providers. If we all do what we're best at doing and work collaboratively, then the benefits to the public of New Zealand can be enormous.
Okay. But listen, I think we'll probably have to leave it there. So listen, thanks so much for being on the show. And I will be putting up this interview on the YouTube. And so, people can post questions into the comment section. And as I said, we'll do the best to answer them at the time when the questions come. And of course, Paddy, I wish you success in getting all the groundwork done and getting that 1,000 acupuncturists all registered. And I look forward to the changes coming ahead.
Thanks, Heiko. I'm happy to answer any questions, or people can simply contact our office in Wellington, either by phone or email. Contact details are on our website, Chinese Medicine Council.
Yeah, so it's a pretty straightforward website. Is it just cmc.co.nz or something, or...?
No, it's not. It's Chinese Medicine Council.
Okay, all right. Well, that should be able to come through. Well, anyway,
spelled out. Yeah.
Yep. Well, let's finish off the show with something symbolic, and I've chosen a song, "The End" by The Doors, and I don't sort of mean it in a negative way. I'm meaning it in a positive way. That it's an end to the old non-registered days of acupuncture and in the end of not being recognised by the government. But from now on, it's all go ahead. And we're all sort of moving forward to a bigger and brighter future. So thanks again, Paddy. And
thanks, Heiko.
Okay, bye.
Bye-bye.
Here's the song.
This is the end, beautiful friend. This is the end, my only friend. The end of our elaborate plans. The end of everything that stands. The end. No safety or surprise. The end. I'll never look into your eyes again. Can you picture what will be so limitless and free? Desperately in need of some stranger's hand in a desperate land. lost in a romance, wilderness of pain, and all the children are insane. All the children are insane, waiting for the summer rain, yeah. There's danger on the edge of town. Ride the King's Highway, baby. Weird scenes inside the gold mine. Ride the highway west, baby. Ride the snake, ride the snake to the lake, the ancient lake, baby. The snake is long, 7 miles. Ride the snake. He's old and his skin is cold. The West is the best. The West is the best. Get here and we'll do the rest. The blue bus is calling us. The blue bus is calling us. Driver, where you taking us? The killer awoke before dawn. He put his boots on. He took a face from the ancient gallery and he walked on down the hall. He went into the room where his sister lived, and then he paid a visit to his brother, and then he walked on down the hall, and he came to a door, and he looked inside. Father, yes, son, I want to kill you. Mother, I want to.
This program was produced by and first broadcast on Radio Hawke's Bay, a community access media station. Thank you to New Zealand On Air for making this type of programming possible.